What is motor mapping during awake brain tumor surgery? Imagine being awake during brain surgery and helping your doctors find exactly where the parts of your brain that control movement are located. That's what motor mapping during awake brain tumor surgery is all about. It's a special technique used when removing tumors near the areas of the brain responsible for voluntary movements. The goal is to remove as much of the tumor as possible while protecting your ability to move normally afterward. During this procedure, the patient is awake but comfortable, with only the scalp numbed with anesthesia. The surgeons gently expose the brain surface and then apply tiny electrical stimulations to specific spots on the brain surface or just beneath it. While they do this, they ask the patient to move different parts of their body or perform simple tasks. If stimulation causes a movement or disrupts a movement, that spot is identified as a critical motor area. The surgeons mark these areas carefully so they can avoid damaging them during tumor removal. This process is part of awake craniotomy, which is often chosen when the tumor is very close to important brain regions that control movement. Because the brain itself doesn't have pain receptors, patients can stay awake during the procedure without feeling pain, making it easier for surgeons to get real-time feedback. This feedback helps them decide how much of the tumor they can safely remove without risking motor deficits, like weakness or paralysis. Motor mapping is just one part of a broader approach called awake brain mapping, which also includes identifying areas responsible for speech and sensation. Before surgery, doctors may use advanced imaging techniques like functional MRI or navigated transcranial magnetic stimulation to plan the procedure. But the direct electrical stimulation during surgery remains the most accurate way to pinpoint critical motor areas. This technique has revolutionized brain tumor surgery because it allows for maximal tumor removal while keeping the patient's movement abilities intact. It's a precise, safe, and effective way to treat tumors near vital brain regions, helping patients maintain their quality of life after surgery. Always remember, every brain is unique, so your surgical team will tailor the approach to your specific needs. If you or someone you know is facing brain surgery, consulting with a specialized neurosurgeon is essential to understand the best options for your situation.